Hello and welcome. Today we'll be discussing penile trauma, a potentially serious condition affecting male reproductive health. We'll delve into the causes, symptoms, diagnosis, and treatment of this condition, providing you with a comprehensive overview to enhance your understanding. Penile trauma can arise from a variety of causes. Blunt trauma, such as from falls, sports injuries, or road traffic accidents, is a common culprit. Penetrating trauma, involving cuts, stab wounds, or gunshot injuries, can also occur. Another cause is penile fracture, which happens when the erect penis is bent forcefully, often during sexual activity. Finally, iatrogenic injuries, meaning injuries resulting from medical procedures, although rare, can also lead to penile trauma. The pathophysiology of penile trauma depends on the nature and extent of the injury. Penile fracture, for instance, involves a tear in the tunica albuginea, the fibrous sheath surrounding the corpora cavernosa, which are the erectile tissues of the penis. This tear can cause bleeding and the formation of a hematoma, leading to pain and deformity. Penetrating injuries can directly damage the erectile tissues, urethra, or blood vessels, potentially disrupting erectile function and urination. Blunt trauma can cause contusions, swelling, and, in severe cases, rupture of the urethra or blood vessels. The epidemiology of penile trauma is not well defined, as many cases may go unreported. Penile fracture is estimated to occur in around 1 in 175,000 men per year. However, the incidence likely varies depending on geographic location and cultural practices. Trauma related to sexual activity is more frequently reported in some regions. The overall prevalence of penile trauma is relatively low compared to other types of injuries, but remains a significant concern due to its potential impact on sexual and urinary function. The signs and symptoms of penile trauma can vary depending on the type and severity of the injury. Common symptoms include sudden, severe pain, often described as a cracking or popping sound in the case of a penile fracture. This is typically followed by rapid swelling, bruising, hematoma, and deformity of the penis. Difficulty urinating or blood in the urine are also important signs, potentially indicating urethral damage. Other symptoms can include pain during erection, difficulty achieving or maintaining an erection, and visible cuts or lacerations in the case of penetrating injuries. Diagnosis of penile trauma typically involves a physical examination and a thorough medical history. The physical examination will assess the extent of swelling, bruising, and deformity. The doctor will also check for any signs of urethral injury, such as blood at the urethral meatus. In cases of suspected penile fracture, an ultrasound or MRI may be performed to confirm the diagnosis and assess the extent of the tear in the tunica albuginea. A retrograde urethrogram, where dye is injected into the urethra and X-rays are taken, may be used to evaluate for urethral injury, especially if there is blood in the urine or difficulty urinating. Penile trauma can be classified based on the mechanism of injury and the structures affected. We have blunt trauma, penetrating trauma, and penile fracture as broad categories. Within these, we can further classify based on the severity of the injury, for example, simple contusions versus complex lacerations involving multiple structures. Specific classifications may also exist based on the location and extent of the tear in the tunica albuginea in cases of penile fracture. Proper classification is crucial for guiding appropriate treatment strategies. Treatment and management of penile trauma depend on the type and severity of the injury. Mild cases of blunt trauma may be managed conservatively with rest, ice packs, pain medication, and close observation. However, more severe injuries, such as penile fracture or penetrating trauma, typically require surgical intervention. Surgical repair of penile fracture involves suturing the tear in the tunica albuginea. Penetrating injuries may require reconstruction of the urethra, blood vessels, or erectile tissues. Antibiotics are often administered to prevent infection. A urinary catheter may be placed to allow the urethra to heal. Psychological support may also be beneficial to address any emotional distress associated with the injury. Prevention of penile trauma involves avoiding situations that can lead to injury. This includes taking precautions during sexual activity to prevent penile fracture, such as avoiding overly aggressive or awkward positions. Wearing protective gear during sports and engaging in safe driving practices can help prevent blunt trauma. Awareness of surroundings and avoiding dangerous environments can help reduce the risk of penetrating trauma. Additionally, proper training for medical professionals performing urological procedures can minimize the risk of iatrogenic injuries. The prognosis for penile trauma depends on the severity of the injury and the promptness of treatment. With timely and appropriate management, most men with penile fracture can regain normal erectile function. However, delayed treatment or severe injuries can lead to complications such as erectile dysfunction, penile curvature, or urethral stricture. Recent research is focusing on improving surgical techniques for repairing penile fracture and developing new strategies for preventing erectile dysfunction following penile trauma. Furthermore, regenerative medicine approaches, such as stem cell therapy, are being explored as potential future treatments for erectile dysfunction resulting from penile trauma.